Thank you for using the Alpha Liner. We firmly believe that your prosthesis will feel more comfortable with this cushioning layer of gel to dissipate the forces applied to your limb. In order to ensure the highest level of comfort and the longest possible life from your Alpha Liner, please follow the directions in this video carefully and be sure to contact your prosthetist right away if you have any questions. Before donning your liner, make sure that your residual limb is clean, dry, and free of soap residue. Do not apply any type of lotion or powder, as it will react negatively with the alpha gel and possibly with the residual limb. Specifically, do not use petroleum jelly, talcum powder, or any other products containing animal fats and oils or hydrocarbon oils, even though these types of products may be recommended by other liner manufacturers. If you have any areas on your limb that require the application of medicine, be sure to cover the medicated area with a gauze patch before applying the liner. If you are using a locking liner, check to ensure that the locking pin is secure. Each of your locking liners should have its own pin, securely fastened to the liner by your prosthetist. If you notice a loose pin, contact your prosthetist immediately. A pin that is not secure could come out of the liner, resulting in the potential for you to fall and injure yourself. To don your Alpha Liner, begin by inverting the liner so that the gel side is facing out, and place the end of the liner against the end of your limb. If you are a below-knee amputee, the logo and serial number of your liner should be in the front. If you are using a locking liner, be sure to center the pin attachment on the distal end of the limb. Carefully roll the liner up onto your residual limb with the gel side against the skin. For optimal comfort, position the seams away from any sensitive areas or bony prominences. Make sure that the liner is rolled, not pulled, onto the limb. Pulling the liner may stretch the skin and result in an uncomfortable fit. Make sure that there are no wrinkles or air pockets between your residual limb and the liner, and then don your prosthesis. For AK amputees, the orientation of the liner is slightly different. When donning an Alpha Classic AK liner or an AK Design liner, the logo should be to the side. For an Alpha Hybrid AK liner, it doesn't matter which way the logo is facing, but the life of the liner may be extended if you vary the orientation of the liner each day. Then, carefully roll the liner up onto your limb. Make sure that there are no wrinkles or air pockets between your limb and the liner, and then don your prosthesis. Proper hygiene is extremely important when using the Alpha Liner. Each liner must be thoroughly cleaned at the end of each day of wear and disinfected once each week in order to prevent skin irritation. First, be sure to assemble the drying stand that was included with each liner. Start by sliding the two base components together, then place the tube onto the assembled base. You may cut the tube to a shorter length if desired to accommodate shorter liners. Clean the gel side of the liner thoroughly with lukewarm tap water and a body soap that does not leave a residue. Please be aware that, for some amputees, antibacterial soap has caused skin reactions. Apply the soap with a clean, soft cloth or sponge. Take care not to scrub the Alpha Liner. Scrubbing can roughen the surface of the liner, which can then irritate your skin. Take special care to rinse all soap residue from the liner, then dry the gel side of the liner with a clean, lint-free cloth. Turn the liner inside out so that the fabric is on the outside and the gel is on the inside. Place the liner, fabric side out, onto the drying stand. Clean your residual limb with soap and rinse well. Once a week, Disinfect each alpha liner by lightly wiping the gel side for 2 minutes with a small amount of ethyl or isopropyl alcohol. Do not use alcohol in large quantities or more frequently than once a week, or the gel may become firmer and less comfortable over time. Rinse off any excess alcohol with water, then proceed with the usual daily cleaning of the liner. Be sure to inspect your alpha liners after each day of use. Unusual wear of the fabric or gel may indicate changes in the prosthetic fit. In order to preserve the warranty of your alpha liners, be sure to contact your prosthetist immediately if you notice any signs of unusual wear. If you do not contact your prosthetist at the first sign of wear, your liner could develop more serious issues, such as the examples shown here. A common issue for many alpha liner wearers is the daily fluctuation of residual limb volume. When volume loss occurs, your limb may move around inside of your socket, resulting in premature wear and tear of your liner. This volume loss does not happen evenly over the whole limb, however. It only occurs in the soft tissue areas, such as the area at the back of the leg in the transtibial example. If you try to compensate for this localized volume loss by adding a sock, what you are really doing is adding extra thickness over the entire limb instead of just in the area where it is needed. The result is a poor fit with high pressure in the areas where volume was not lost. Instead, your prosthetist may recommend using alpha volume management pads to add volume precisely in the area where it was lost. Simply place the thin, tapered edge of the pad against the skin, then don the alpha liner. Multiple pads can be stacked on top of each other if necessary. The result is a proper fit with no areas of high pressure. If you have any questions about alpha volume management pads, please contact your prosthetist for more information. When your alpha liners are not being worn, they should be stored in a cool, dry place, out of reach of children and pets. If a liner will not be used for an extended period, cover the dry liner with a clean plastic bag. By following the simple steps in this video, you will be helping to obtain the highest level of comfort and the longest possible life from your alpha liner.